Hello everybody, I'm Dr. Fiona Rawlinson. I'm a reader and Programme Director of the MSc in Palliative Medicine for Health Care Professionals. We're really delighted that you have got some interest in the course. It's a 3-year master's course. The first 2 years are the taught stage and the third year is the dissertation stage. During the taught stage you follow 6 modules with one optional module which is around the ethical, legal and complex palliative care challenges either in the adult population or in the paediatric palliative care population. Otherwise, the course is co-taught, it's interdisciplinary. We teach paediatric palliative care alongside adult care because we've found with our now 20 years plus experience of co-teaching palliative care for adults and paediatrics that there's so much integrated learning and so much that we can all learn from each other. So the first 2 years is a series of 6 modules. You cover symptom control, communication skills, frameworks for thinking about delivering palliative care in your setting. The course is not just for palliative care specialists. Palliative care is a skill that all healthcare professionals from all disciplines need. Indeed, some of the most important and impactful palliative care is undertaken in the emergency department, in care homes, in nursing homes, in care of the elderly wards, in respiratory wards. So by teaching everybody together, we really get some shared learning of delivering palliative care in the settings where you work. We also cover team working and leadership. Palliative care is a team activity. We need to be able to interact and communicate effectively with different members, not only of our own team, but having advice from other teams, working with other colleagues, keeping the patient at the centre of everything that we do. And the patient voice is never far away from any of the assessments or any of the module material. So it's very much a clinically founded and centred course. During the last 2 modules of the taught stage, then we cover the elements of understanding the evidence and research design, and we cover elements of understanding some of the frameworks upon which quality improvement work is based. And this is deliberate. Some of you will decide after 2 years to leave before doing the dissertation, and if you successfully completed the assessments and gained 120 credits, then you would exit with a postgraduate diploma at that point. Others of you may want to take things on to that 3rd year, that dissertation year. And this is a year where you can think about a project in more depth, think about a topic, what's really inspired you during your palliative care journey so far. You undertake a project. This is either a research project, either primary research, or it could be a systematic literature review, or a quality improvement project. This is supervised, you get a lot of support, a lot of feedback. The end point needs to be a 20,000 word dissertation, which is submitted on round about September the 30th in the year following your enrolment on that 3rd year, that 3rd stage. We provide a lot of support during that year with supervisors or co-supervisors and really helping you get the most out of the discipline of critically appraising literature, undertaking your study, so that element of intellectual curiosity, that master's level thinking, and then pulling it all together and writing fluently. Now, some people may think, well, I'm never in my life going to need to do 20,000 words on anything again, but I'd ask you to think again. The academic skill of being able to critically appraise, pull together ideas and then write fluently in a way that others can understand is incredibly useful. It's really useful for building business cases, for developing your teams, etc. in your future career, whatever that might be. We're really excited about the dissertation stage. Our dissertation stage students have presented their work internationally. They have written papers for peer-reviewed journals, they broadcast, they share it widely, but it's so incredibly important, particularly at the moment, to help really continue the foundations of palliative care research wherever you are. So as I say, the course is international. If you join us, you would be working alongside online, you'll be working alongside peers from all nations, all countries, all continents, and that's the real beauty of the virtual landscape. So generally, let me come on to that. How's the course delivered? It's a blended learning model. So at the start of each academic year in September, there are teaching days. Traditionally, these have been face-to-face. With the COVID-19 pandemic in 2020, we had to deliver these virtually with extremely good feedback and lots of ongoing impactful evaluation, including virtual communication skills, which of course is so useful at the moment with some of the continued restrictions. I'm recording this in June 2021, and we have had to take the decision for this year once again in light of uncertainty around COVID restrictions and travel restrictions and quarantine and isolation and impact on clinical teams. Once again, we've decided to offer the teaching at the start of the year in September 2021 will also be virtual. We'll be using Zoom as a platform, but we have now got a lot of experience of making these virtual teaching sessions incredibly interactive. So we'll be asking you to keep your camera on. There's lots of small group working and breakout groups and interaction. We are hoping that if COVID-19 restrictions are workable, that we will be able to offer some face-to-face teaching in March or April time next year, particularly around communication skills. But we can update you on that. Our Twitter feed is @CUDipPalmed, so that's where we tend to put general announcements for people who may not as yet be enrolled on the course. But during those teaching days at the start of each year, they're incredibly important days because that's where you build your own personal community of practice. You meet your peers, you do small group work, you do communication skills. Our communication skills is very developmental. It's formative feedback, it's discussing, it's talking. There's a little bit of role play, but it is facilitated by skilled facilitators. So we find that as people leave the teaching days and going back into clinical practice, there will be something that you will have heard or seen or thought about which will change your practice. And don't forget, everything you do has to be with improving the palliative care that you deliver to your patients where you are in your setting. We're proud of the international element, so hearing how different parts of the world tackle things like collusion and denial and truth-telling around breaking bad news, it's really important learning. The rest of the course is online, but it's a combination of reading lists, tasks online, discussion board activities, some blog activities online, and online tutorials, which we try to make sure are at acceptable times for the different time zones everybody is, but that's a chance to think about a topic in a little bit more depth over an hour, possibly with some pre-reading, and just kind of discuss with colleagues how you might tackle specific situations. Each of the 6 taught stage modules has a module lead who undertakes all the academic activity and coordinates marking and feedback and can answer queries about the module. But all of our students, as all of the students at Cardiff University, you'll have a personal tutor who really is there for support and guidance. It's tough sometimes studying at master's level as a postgraduate healthcare worker. You're juggling the clinical work, family commitments and engagements, and studying at the same time. Now, we understand that, but we also understand the drive that has led you to be interested in doing a master's, so we want to support that as best we can. The course is run by myself as Programme Director. I'm also a module lead. I do other things as well in palliative care education, and I'm a practicing consultant in palliative medicine. And I'm joined by an exceptional academic team. Some are clinicians working as consultants, others are researchers, but all with an aim to really help you develop your palliative care skills. We're part of the Cardiff University Postgraduate Taught section of the Centre for Medical Education, so we work alongside colleagues delivering all the other postgraduate taught courses, which means that we also have a community of practice, and we're constantly thinking about what's the best way to teach about this subject, what's the best way to get feedback. So it's a very connected group. Our support staff, administrators, Joe Richards and colleagues are key to the smooth running of the course. so you'll get to know them, I'm sure, very well during the time that you're with us. But for us, it's important that although you're working at a distance where you are, you still feel connected with us. So responding to emails, sometimes you may not be able to get a response that day because our academic team are all working clinically as well, but we will do our best to answer queries and to make you feel connected during your time with us. I studied the Diploma of Palliative Medicine between 1994 and 1995, and at that time we recorded cassette tapes of interesting speakers and huge numbers of paper envelopes studied on my floor once a week. Now online, of course, it's different. We do still have the interviews, but they're podcasts. So it's really collecting different ways of delivering material to make it interesting, to make it impactful, but to change your practice so that the practice of palliative care, whatever specialty you're in, whatever discipline you're in, whether you're in a hospice, whether you work in a hospital, whether you work in a care home, the practice of palliative care to your patients to improve their quality of life for however long that life is. We hope that that will change as a result of studying with us. So I look forward to welcoming you on the course in Cardiff, and be very happy to answer any queries on email that you've got. Thank you very much. Good luck.